Thank you, Mr. Speaker. Mr. Speaker, we hear about horror stories about our emergency departments. They are not made up but come from experiences that our dedicated, caring health professionals face on a daily basis. They are incidents that emergency doctors have documented. They are real stories, and they are real people. Why do I say real people? Because I was one of them. My mom is 86 years old, and she fell, and so our journey begins. Spending hours, and I mean hours, in the emergency, we were finally admitted. Now, we already knew my mom's elbow was fractured, and we already knew that she would have to have surgery. But what we didn't know was the length of time it would take to get there. Not only did we wait hours in the emergency, but we waited days to have the surgery. You have a vibrant, active senior who is now confined in bed for days, not eating on an IV, and guess what happens? You get other complications, heart problems, fevers, and a senior that ends up in a hospital for 6 weeks. Now, we hear about our seniors and how they're tying up the acute care beds. Well, it's no wonder why some of them are doing that. I do want to commend the wonderful doctors, the nurses, the LPNs, the NAs, the farm techs, and all the unbelievable other people that touched their lives when she was in the hospital. There is good news and there is bad news in these stories. On the good side are the dedicated, compassionate healthcare workers that work hard under unbelievable conditions. On the bad side is Alberta Health Services and the government who just doesn't get it. 10 months ago, I stood in front of reporters explaining why I was crossing the floor. There were numerous reasons, Mr. Speaker, healthcare being a major one. A broken system can be fixed. It can be fixed by providing the right care at the right time, at the right place, by the right health provider in the right period of time. Mr. Speaker, no one could have quoted it better than my mum when I asked her about our healthcare system, and she said, "It's the pits."